Well, this has been a terrific discussion. I want to thank everybody on the panel for their active participation in the discussion. We reviewed a lot of important information about emerging concepts in the treatment of both ovarian and cervical cancers. Before we end the discussion, I'd like to get a final thought from each of our panelists. And if we would, we'll start with Dr. Coleman, then go to Dr. Herzog, then Dr. Monk, and then Dr. Secord.
Well, I mean, I think this is a great time for us in the GYN oncology sphere for the development of new drugs and integration of these drugs into practice of care. I'm very excited, and since this is just the precision medicine field is just exploding, we're really excited to see it develop. Tom?
So Tate, thank you again for having me. I appreciate it, and it's truly a pleasure to be part of the panel. I think that I'm an optimist, I said that earlier, and I'm very excited by all the new pathways and new drugs that we have to talk about, and really it's amazing how much there is out there. I think one of the things we have to be careful of, though, is if you look at, it was an interesting article that came out in Forbes this week that looked at over the 5,000 abstracts presented at ASCO this year. And they looked at the pathways and they looked at everything. Over 3/4 of them, of the pathway ones, had involved ERB family, and everything else, that was anything even second was the whole oncoimmunology, checkpoint inhibitors, PD-1, PD-L1. And I just worry a little bit that big pharma, especially, and others are somewhat in the herd mentality, and I think we need to be a little more creative with all the new discovery that we have out there, and that everything shouldn't be just one permutation or one off. And I understand that there's got to be a profit motive behind some of these things, but I do think that the science should lead us more than anything else, and I don't think that's the case if we're all looking at exactly the same thing. I think there's other influences.
Well, I don't know if it dawned on you, but cervical cancer was had the highest cancer-related mortality where there was not an approved agent, targeted therapy, that is. And in this country, ovarian cancer was the highest cause of solid tumor-related mortality where there was no approved target agent. So we had the global one, and we also had the U.S. one, and we overcame both of those barriers in 2014. So I thank all of you. I think that's a huge accomplishment happening both in 2014. The other thing that I want to remind you is that the gynecologic oncologists, or the researchers, Tate, you, brought us paclitaxel to the space. It's been very rare for gynecologic oncology to bring a new chemotherapy to oncology.
Tate brought us nitrogen mustard, didn't he?
Seriously though, but we led to we were the first approval, right, of paclitaxel. We're also the first approval of a PARP inhibitor. Okay.
Yep.
And so I think I'll bet that PARP inhibitors are going to resonate throughout oncology. You've heard about prostate, you've heard about pancreatic, you've heard about breast, you've heard about many other tumors, lung, and we're going to see other indications and combinations. So I think this is really an exciting time, both from a global perspective in cervical cancer, breakthrough targeted therapy, and now we brought a new agent.
Well, Tate, thank you so much for inviting me to be on this panel. Maybe you'll invite me back if I don't talk about individualization anymore. But it's really been an honor and pleasure to be here and very informative. I think 2014 was a fantastic year for all the reasons Brad mentioned. I mean, how exciting it is that we finally have 2 approvals in ovarian cancer, and it's been since 2006. What I've noticed that was very striking at ASCO is PARP inhibitors and immunotherapy are out there, and we'll see how these agents can improve care for our patients clinically. I also echo Rob's comments in terms of precision medicine. Biomarkers are going to help us identify patients that are most likely to benefit from these agents and improve survival, and that's really what this is all about.
Yep. Okay, well, thanks to all of you for your contributions to this highly informative and educational discussion. On behalf of our panel, we thank you for joining us, and we hope you found this peer exchange discussion to be useful and informative. Thank you.